Someone who would benefit from visiting with a genetic counselor is usually someone who has a certain disease that has been present for multiple generations in the family and they're worried about it. So in cardiac genetics, it's usually someone who has maybe a grandmother or a father who has had a very similar cardiac disease and they're concerned about that risk for themselves. What we try to do is collect as much family history as possible, and sometimes we leave them with homework where they come visit with us and maybe there's a few questions that we need answered to try to figure out what exactly is going on. But sometimes people bring additional family members to also help supply that information for us. And we also will talk about what condition that they are concerned about in a family. So if they're concerned about a specific heart condition, we'll talk about the details of that condition and talk about the differences between hereditary heart conditions and maybe those that are more sporadic. And we're just determining if there is a potential risk for a genetic disease. That doesn't necessarily mean that we'll be doing genetic testing. Oftentimes, genetic testing is better done on a different member of the family, and we would talk about the significance of that and what that means for the future. So if we identify a genetic explanation for a specific heart condition, we can look for other individuals who may also be at risk for that condition, and it can help us to know who needs to be screened in the family who hasn't inherited that genetic risk. So it can also provide them with some reassurance from that end. So if we catch an individual that might be at risk for a genetic condition, we can put them on a screening regimen where maybe there's a medication that will help them, or maybe we need to have more frequent screening such as an echo. Maybe they need to see their cardiologist a little more frequently, or there might be some physical activities they need to abstain from. Cardiac genetics is really in its infancy, where we're learning so much about the risks for cardiovascular disease. If we look ahead to where cancer is in genetics, it's very possible that in the future there might be certain medications specific to gene changes that really can benefit a family. I really enjoy meeting new families and hearing their stories and hearing their concerns, and I always hope to reassure them with that information, even though sometimes people feel that visiting with a genetic counselor is scary. It's not scary, it's empowering to know if we are at risk for something, what can we do to be proactive in taking care of that risk versus just waiting and being afraid.